Now, this Wednesday, we have something really interesting to discuss. Have you considered, making sure your family is secure health-wise? What have you put in place to make sure that this is possible? Whenever your children have the sniffles, which medical facility are you taking them to, and how do you pay for it? Now, we are joined this morning by Dr. Emanuela Zamba. She is the Permanent Secretary, Lagos State Health Management Agency. It's great to have you here, ma'am.
Thank you for having me.
All right, so I know there's something special that is on the horizon, and there's been an executive order to make sure that people understand how seriously Lagos State is taking this package. Please give us a breakdown on what's coming up.
So about 2 weeks ago, the Lagos State governor launched the standard JARA health insurance plan, which is the social health insurance plan of Lagos State, also dubbed as Ilera Eco. And that plan essentially is for everyone in Lagos State. So you did mention the executive order. That executive order came out the day after. And the executive order explicitly says that everyone in Lagos State, as long as you live here, you should buy into the social health insurance plan. Of course, a lot of us do have private health insurance. We are not precluding your private health insurance for those that can afford it, but we're saying that everyone must have the social health insurance plan, and then you can get a top-up on added benefits from your private health insurance provider.
So there is something about the average Nigerian not really thinking about, the possibility of having malaria until it actually happens. And then they find their way to a pharmacy, and then they, self-medicate, and they just feel like they're okay. I am so concerned about the way we as Nigerians just take that option that, okay, don't worry, when it happens, then I make that move. What exactly is it we can tell the people right now for them to understand the importance of health insurance?
So self-medication, as you said, is a major issue in Lagos. A lot of people, I think it's more of a cultural thing. People have the mindset that why would I have to pay for sickness to come and visit myself or my family? That is a lot of the things you'd hear when you go with the masses. That's what they say. So they'd rather spend their money on things that's tangibles and they can use right now than pay for something that they're praying for does not happen. So what we're saying is we have brought out this social health insurance plan, which is extremely affordable. If you look at the scope of services within that benefit package, you would see that you are getting a huge bargain for a very small amount that you're going to have to pay. You can cover yourself and your family. A lot of people don't really understand the importance of health insurance until there's a serious catastrophic illness in the family that now wipes off. So maybe you were very comfortable before, and suddenly the wife or someone in the family develops a cancer or has a really serious issue that needs surgery or so on. You now start running around looking for funds, borrowing money and stuff like that. If you have a health insurance plan, you can be confident that if something does come, something will come up. Illness doesn't tell you when it's going to come, and it doesn't tell you the severity of what it's going to bring your way. So when you now have that sort of thing in the family, you can walk up to your provider very confidently without having even a dime in your pocket, and you're sure to get a service. So it helps you to, you're more or less saving for a rainy day. And then when it comes, you don't have to, now you can sort of like maintain your quality of life. It also helps you. You can now, look for good schools, start, rather than waiting, this thing suddenly comes, and then you become, your level of comfort drops to rock bottom simply because you didn't plan for it.
I'm going to, touch on this issue. We've seen so many stories online of recent of people just slumping and passing away for no apparent reason. And, some people have equated it to, people in the village. But there have been some statistics showing, the rise in issues with blood pressure, issues, heart disease, undetected.
Correct.
Because of the fact that people don't go for medical checks.
Exactly.
So I've always been, of the opinion that if, people felt like they had access to at least very low-cost medical checkups, they would be able to detect these issues more often. So with the package you guys are talking about now, if, for instance, we, wanted to go for full medical checks, what would we have access to?
Fabulous question, and creates an opportunity to give better justification. So for 15,000 naira for an individual per year, or 55,000 naira for a family of 4, which is husband, wife, and 2 children, or 80,000 naira for a family of 6, husband, wife, and 4 children, all of them under the age of 23, you have access to annual wellness check, which is what you're talking about.
Annual wellness check.
You can have an annual wellness check. So we'll screen you for the common cancers. You can look at your cholesterol. You can have a chest x-ray done. All the normal sort of things that you would do. I'm not talking about the high-end faluting tests, but the basic
EKG,
thing that would be, you can have an ECG done.
ECG
that is also covered,
Okay.
right? You can have your blood tested. So they will do a blood panel for you and check and make sure that everything is okay, And I mean, with the health insurance, you can walk in, have your blood pressure checked, get your monthly prescriptions, depending on what the doctor has put you on, be it diabetes you have or hypertension, all those things are covered. We even provide some level of cover for cancer care, for instance.
Wow.
So if you've been with us by the 2nd year of your being on the plan, if someone happens to come down with cancer, we are able to support you up to a tune of about 2 million
Wow.
to cover whatever care that you need. We also do dialysis, so you're entitled to, maybe you come down with an acute renal failure, not you, I mean figuratively.
Yeah.
We do have a provision for you to be able to have dialysis done. You can get admitted for up to 15 days. You can have surgeries like appendectomy, a herniorrhaphy, a lumpectomy.
Wow.
We do eye surgeries under it as well. You can have a cataract surgery.
And this is covered for family of 6, family of 4?
6, you'd have to pay 80,000.
Wow.
Family of 4, you pay 55,000. And if you're an individual, you pay 15,000. So you can see, if I go on, that benefit package is really robust. And the benefit is that because you're on a social health plan, which has a massive pool, we're able to drop the cost, and it's something that is now affordable for, most people.
I have to say a big thank you to you for coming to sort of break this down. I know that there's a lot more details, and there'll definitely be opportunities for people to find out more about this. I know that there is a website.
Yes, lashma.com.
Fantastic. Lashma.com if you want some more details. Now, taking care of our families is our main focus in times like this. Yes, taking our health more seriously in 2024 should be first on your list.